Hello everybody, good evening. Welcome to Nurse Note channel. Today we will speak about reversible cause of this. What is the cause of this? If we treat it, the patient will come back again. Okay, we will divide it to two parts: 6H or 6 things start by H and 5 things start by T. Okay, the first thing in H, hypovolemia. If the patient have bleeding, internal bleeding or external bleeding, or the patient have severe diarrhea or severe vomiting, this causes for hypovolemia. So here, if we give the patient fluid or give the patient blood or blood product, so the patient here will regain conscious level again. The second thing is hypoxia. If the tissue oxygenation not enough, so the patient auto saturation will become below 90. We know the normal range for auto saturation for the patient from 95 to 100. So we accept until 90. If this patient start to decrease 80, 70, 60, so like this the patient have hypoxia. If we put the patient on ventilator or put oxygen to the patient, so the cause will release, so the patient will not arrest. Okay, the third thing is hypoglycemia. We know that random blood sugar for the patient normal range from 70 to 110. Okay, so if blood sugar decreased to 60, 50, 40 like this patient have at this time hypoglycemia, so this patient will loss of conscious level. At this time the patient may be arrest. So if we do RBS for this patient, at this time we know this patient have hypoglycemia, we will give him D50 or D25, so the patient will increase in RBS again, so the cause will relieve, the patient will not arrest. Okay, hypothermia. If the patient have fever or have hyperthermia, so we do for him cold compresses. Please don't do cold compresses with ice, please. If you do cold compress for the patient, do with tap water, because ice makes the circulation become too to relax. So this patient have hypothermia, his temperature below 35 degree. Okay, so here this patient may be lead to arrest. If we treat this hypothermia, so this patient will come back again. Okay, hydrogen ions. The patient have acidosis, metabolic acidosis or respiratory acidosis. If metabolic acidosis, we will give the patient bicarb or treat this one. If respiratory acidosis, the CO2 is high, so this patient we will put him in mechanical ventilator or give him oxygen, so this acidosis will be treated. So hydrogen ions is cause of cardiac arrest. Hypo or hyperkalemia. This is the level of potassium. Potassium. So we know the normal range of potassium is from 3.5 till 5.5. If below it is hypokalemia, we will give the patient potassium or give him supplemental to increase the level of potassium. If increase than more than 5.5, like 6, like this, we will try to decrease the level of potassium by giving calcium, giving ventricular nebulizer, giving glucose insulin for the patient. The last thing we can do for him, we can do dialysis for the patient. Okay, so here hypo or hyperkalemia, this is cause of this. If we treat this one, the cause will relieve and the patient will come back. Here the 5T. The first thing is toxins. The patient, if the patient have lanoxine toxicity, we know there is level for lanoxine. There is normal level for lanoxine. If the patient take lanoxine, so if this level increased, so the patient have lanoxine toxicity, so we will give him a hair antidote and stop lanoxine. So we know the cause and we will try to treat it. Okay. Here also in toxins, the patient who take drugs like cocaine, if the patient take cocaine or something like this, so it is maybe cause. So if he stop and we try to treat him, so the cause will relieve. Here tamponade. The patient here at the pericardium tissue, there is in the sac there is fluid, blood or fluid accumulated around the blood. So this compresses the chambers or the ventricles of the heart. So the heart here can't contract properly. So here the cardiac doctor or cardiology doctor try to solve this one by putting needle attached with catheter to draw or do pericardiocentesis for this patient. So at this time this fluid will release, so the heart chambers, heart ventricle can contract properly and send blood to all the body. Okay, here thrombus. If the patient has thrombus here, like pulmonary embolism or myocardial infarction or MI. Pulmonary embolism, this is the thrombus in the chest, in the lung. Okay, So we will give him thrombolytic. So at the time we giving him thrombolytic, this thrombus will be released or decrease the decreased sign and symptom which appear on the patient. So here we can treat thrombus. The first thing is trauma. If the patient have head trauma or cervical trauma or anything of this, we can know the complication of this one and we can treat this one. Okay. The last thing is tension pneumothorax. If the patient have air around the lung, so it's compress the lung, especially if the patient can't breathe or have shortness of breath. At this time, when the patient come, we do chest X-ray for him, so we diagnose, or the doctor with us diagnose this patient as pneumothorax. So he start to put for the patient chest tube to draw or pull the air from the lung, so the patient can breathe good. So here we know there is 6H and 5T. It's very easy. Thank you for watching. We finished our video today. If you found this one is good, please don't forget to do subscribe and share. Thank you.